Mitra, welcome to the show. How is it going today?
Perfectly well. Thank you so much for having me here, Dr. Evans.
Oh yes, absolutely. And I'm not a doctor, so I am I always joke around that people ask me, "How'd you start working with physicians?" Well, my mom always told me that spent so much time in the emergency room that I should have just gotten my own room there. So that was my introduction to physicians. But from that point on, the rest of our lives, I have so much gratitude for what you do, the dedication that you have given to your craft, to your passion, and what you've given up along with your family. So thank you. Let's just get started from there, Mitra. Thank you for what you do.
Yeah, thank you very much for saying that. Sometimes I think as a community, we are not feeling it,
Yeah.
so I appreciate it. So I am a practicing physician in Florida, a nephrologist by training, which is a kidney specialty of kidney disease, and I'm in solo private practice. And thank you for bringing up the point that you brought earlier about the state of healthcare, because that is innately related both to how I practice and what I am doing as my other venture. Because, as you said, money is involved, and it does make a difference. We all know, especially if you're an insider in the healthcare industry, that the cost of doing business and reimbursements in general are going in opposite directions, which has made it very hard to survive in private practice as a whole. There has been a lot of consolidation, a lot of buyout of small practices by corporate entities, and that has really shifted how healthcare looks from a 30,000 foot view. And it makes a difference both for physicians and other healthcare professionals as well as patients. So I was initially a few years back just doing some locums work around town to give myself the most amount of flexibility with my children who were younger at the time. And then I wanted to get into practice. But then I did a back of the napkin calculation, and I was like, you know what, with the way overheads look, there's no way I can make the kind of income I would like to and work the hours that I want to work. Because I was hearing of burnout everywhere, both online and among friends in real life. It was like, so I knew if I go that route, working full time, the 60, 80 hours a week, I'm going to go there myself. And I was like, all right, so I do want to work part time, both for my own sake as well as for my family's sake. So then I had to get creative and figure out, okay, how do I do this? How do I be my own boss and work the hours I want to work and still give patients the kind of care that I want to give? So what I came up with, the other option is probably to get out of the insurance paradigm, but I didn't want to do that because, especially for my patient population, that is going to be hard. And I wanted to work within the paradigm. And so I came up with trying to keep my overheads really, really low. I did that by focusing on the two biggest expenses for a small practice: office space and staff. These are the two big ones. Like for personal finance, it's house and car, as they say. And if you focus on those two, you can, drink all the lattes you like. So, with office space, I work out of a shared workspace location, thereby keeping my rent exceedingly low. And for staffing, I actually started what is called a micro practice, which means I did everything from answering the phones to the billing aspect. And that was awesome in hindsight, because I got to learn all of those processes. I got a look under the hood, because before I did that, I didn't know what really happens after you sign a note and hit submit. Where does it go until it becomes cash in your bank account? I was just staying in town, working for a couple other groups, not all kinds of, like not all different groups and stuff,
Right.
basically helping them out. And so I was not an employee, I was an independent contractor.
Yep.
Yeah, yeah.
And
To
I
your earlier point about, and it's a very fair point about trying to do everything oneself, the idea is not to get burnt out either in an employed position or even working for yourself. You're just
yes.
trading one job for another. So that is not the idea. How I dealt with it was when my volume picked up enough that I found myself dealing with administrative tasks in the evenings or weekends, that's when I was like, all right, it's time to probably hire someone. And at that point, I hired a remotely located virtual assistant to take off a bunch of stuff off my plate. And it's amazing how much can be accomplished remotely. So I often kid that she takes care of everything except the doctoring, because so much can be taught, the process is made simple, such that they can be done remotely. So I launched this online platform called linkmedicalspaces.com, which is a platform to connect healthcare professionals with medical office space. The background of it, let me, if I could go back a little bit. When I was looking to start the practice, I was actually looking to sublease space from an established practice in my neck of the woods. All I needed was one room for 1 to 2 days a week, because I knew that I would be starting slow and it would take time for the practice to build up. But I could not find any such space. I did not know where to look, and I cold called a few practices and didn't come up with anything. And since then, the seed was planted at that time. So that is my why for creating this platform, and it's really very simple. It is a medical office only platform, so you're not getting lost in millions of other kinds of commercial real estate listings, etc. And it's very simple. So for example, if you are starting out a practice or expanding to a new location, say a satellite location, or you're trying to wind down but not quite ready to retire, or any of those things, and you need a little bit of space, you can look for available spaces on the site. On the other hand, if you're an established practice and you have office space and everything is going just fine, you don't even notice all the waste that's all around us in medicine, the redundancy and the waste. And one of the biggest ones hiding in plain sight is office space. Say, for example, you have a 3,000 square foot space, and you're practicing there, but the rooms at maybe the 1 to 2 rooms at the end of the hallway are lying empty. They're just filled with boxes, and you had plans for them, but life goes on and they're sitting empty. So you can get those ready, make them into exam rooms, and sublease them to somebody. They would be perfect either if you're not in the office. Say you're a surgeon and you're in the OR 2-3 days a week, and your office is sitting empty. That's a great opportunity for you to sublease it out to somebody else. Or say you want to take Fridays off, so the office is empty on Fridays. Or say every day of the week that 1 room or 2 rooms are not being utilized. It would be a great help to that other person who is trying to start up a practice or looking for a little bit of space, and it would be a great passive revenue stream for you and your practice, because the space is already there, the utilities are already there, it's already getting cleaned, all of it is already in place. So why not optimally utilize what is probably the biggest expense for a practice? Whether you own the space or you're leasing it, medical office is really expensive.
So if we could go fast forward in 10 years and Mitra was sitting there happy as all get up, maybe celebrating her hell yeses in that regard, what's one thing that Mitra in 10 years would tell you today?
Sit back, enjoy the moments, but keep working towards your goals.
Progress.
Yes.
Progress.
Yeah.
Constant and never-ending improvement. That was an old Anthony Robbins quote. Constant and never-ending improvement, can I? And in that improvement, always making progress, but make sure, please, that it aligns with values that are deep in you. Because progress has to be aimed. We have to make sure that we're staying on focus and we're not just getting busy, and we don't find ourselves in these moments where we're creating more opportunities to lose who we are. So this is awesome, Mitra. I'm so excited about this. I hope you can tell. I'm going to share this as much as possible. The listeners can find you at linkmedicalspaces.com and connect with you.